So I'm joined today by Dr. Alan Bauman. We've been associated for many years, and it's great to get him back on camera interviewing him. He's been a busy guy. He's been over in England. You've been all over, Alan. But what I want to ask you is, you've been a pioneer in the field for decades. And from your perspective, how has hair restoration truly evolved, both technically and ethically, since you started out? And, give us some insight into that.
Yeah, Spencer, first of all, great to be with you as always. And it's truly an honor to be with you here on the call with you because you're such a light in this dark chaos of the hair loss industry. And so it's great to be on with you. But
Appreciate
so
it.
it's nearly 30 years that I've been in the field, 28 years in my own practice, and I've seen a huge amount of change. Now, remember, back in the 1990s, things were, let's say, a little bit less sophisticated. And most of my friends, and certainly my family, who had heard that I was interested in hair transplant, thought that I was totally crazy. And primarily, that came from the idea that old style hair transplants way back 80s and 90s were basically ugly looking and they were a painful process to undergo. And what I was seeing really from the word on the street and from a ground level visiting physicians is that things were changing and they were changing very rapidly. And so what has happened over the past 25, 30 years is that we've gotten down into single follicle implantation. I think that was a huge breakthrough instead of the old style plug type transplants. And also being on the forefront of minimally invasive hair transplantation, meaning that we no longer have to take big punches or a big strip out of the back of the scalp anymore. And I know you can personally attest that you've been through a number of those types of procedures, but it's certainly a lot more comfortable and a lot quicker recovery for patients to undergo FUE, follicular unit extraction. And so, being one of the pioneers of FUE, seeing the changes in just the surgical techniques to be able to have unique control over the angle, the orientation, the position of every single hair follicle that we move around. That's what's really led the charge, if you will, in terms of delivering undetectable results. And it's been a fun practice. I've treated well over 30,000 patients, performed over 14,000 surgeries in my career so far, and I have no intention of stopping. So there's been a lot. The surgical techniques, the aesthetic assessment of the patients, and then of course the prevention, right? So if you can prevent the future hair loss, then you can access much better results on the back end in terms of hair restoration.
Well, that leads me into the next question. Obviously, a lot of people still jump straight into surgery that haven't done their due diligence and haven't necessarily researched this correctly. So, what's your message to patients about prevention and early intervention and building the right foundations before considering a hair transplant?
No, and it's very common. And even in my practice today, parents, let's say, bringing their children in who are in their early 20s, and they want to support their child. They want to be able to provide them, whether it be braces or the rhinoplasty or whatever it might be, and hair is a part of that. Those patients, those young men are excited. They want to get straight into the hair transplant
Of
process.
course.
We push the brakes hard. And what that means is that I spend an hour with those patients, primarily talking about how to prevent the future hair loss that's going to occur. Because, it's not so easy to dissuade them to undergo surgery. I've got, like I said, nearly 30 years of experience. We know we've got to stop and slow down the hair loss process before we do any kind of surgical intervention whatsoever. So we spend time talking about the big boys, finasteride, minoxidil. We talk about red light, how it works, how well it works. We talk about regenerative medicine like PRP, PDO with peptides, you name it. We talk about all of those different modalities, even the lifestyle factors that might be accelerating their hair loss situation. And we take a very holistic approach. We measure them at the get-go. So we know exactly what their hair loss status is, literally down to the hair and the quality of the hair in each different zone, and put them on a therapy and remeasure them 90 days, 6 months, 9 months, 12 months, maybe longer, to ensure that these young men understand the commitment that's required to fight the hair loss process.
Yeah, because it's a very powerful word, and it's one that's very much in sync with hair loss and hair restoration, the commitment. But you and I both know it isn't just about hair; it's about confidence and the emotional kind of recovery. So, how do you and your team approach the psychological side of hair loss in your consultations?
It's critical, actually. So, a compassionate approach from the very first call, click, or visit, or any person, man, woman, or child that comes in with a hair loss situation, obviously they have concerns. And so we have to be empathetic. We have to be compassionate. We have to be professional. And that means being able to understand what their hair loss situation is, get to the right diagnosis, look at what changes are happening in their quality of life. Because look, they're going to have to make a decision to really fight the battle, especially if it's androgenetic alopecia, male or female pattern hair loss. It's chronic and progressive. It gets worse with time without treatment. They're going to need to make a lifelong commitment to some kind of treatment because we don't have a miracle cure right now. And so, but I will tell you that on the brighter side, even though the young men and the women that come in are devastated with their hair loss situation, just stabilizing their hair loss makes an enormous change in their quality of life because what they've been seeing is a gradual decline. They've been seeing the decay, the receding hairline, the thinning in the frontal zone, thinning in the crown, or for women, a decreased ponytail volume or coverage or having to change their hairstyle. And just knowing from the data that they're improving their situation or that they're just stabilizing it, I mean, that's a huge win right off the bat. And it's certainly possible for the vast majority of patients. If they're compliant with the treatments and they come back in for the measurements, we're going to be able to demonstrate a positive result. And that's a positive change in their quality of life. They're going to see a huge benefit there. And that's without even doing any degree of transplantation yet at that moment. And of course, as you know, restoring a thicker, fuller, healthier head of hair has an enormous benefit in terms of quality of life.
Indeed. And, as we both attest to, early intervention is key because sadly, you've lost 50% of your hair before you start to realize you're even losing your hair. So, and this is where the consistency comes in with getting proactive with, a clinic like yours that's got an incredibly comprehensive kind of regime that can be applied. I mean, I remember coming over to you several years ago, and you kindly kind of gave me the day round the Bauman Hospital, which was a remarkable place. So, tell us a little bit about the different kind of treatments that you provide at Bauman Medical, or should I say, the hair hospital.
Well, you should see it now. Obviously, we have a nearly 13,000 square foot facility. I'm building out another approximately 1,000 square feet to address the scalp health issues and other parts of that may be impacting patients' lives. What you would see at the practice is a very, very detailed evaluation. So as I said previously, it's about an hour long evaluation. So patients come in, they've already submitted, if they've had blood work, for example, they've already submitted that. We do a quality of life and mood assessment when they come in. So again, we had touched on that, what happens
Right.
with patients when they're dealing with hair loss issues and maybe sometimes even with treatments, as we have heard. And so then we're going to proceed with a physical examination. We're going to look at their scalp. Is there any scalp health issues going on? Have they had inflammation, itching, irritation? Is it oily? Is it dry? Is it flaking and so forth? Because as we know, inflammation at the level of the scalp also can disrupt hair follicle function and therefore trigger hair loss and also make you less responsive to treatments. And this is something that obviously you can't do, on a WhatsApp text message from someone across the world.
No.
And then when we measure the hairs, we're literally counting the individual hairs in different zones. And obviously, it's an AI powered microscope that does that. And we're physically measuring different bundles with hair mass index, as you saw when you came in through the office. We're going to talk about all the different types of therapeutic interventions that we do. So, the holistic approach, meaning the lifestyle factors that might be influencing hair. So, how your sleep? What's your diet and nutrition looking like? Are you on any medications? Are you taking any meds that might interrupt or disrupt the hair follicle? What does your hair hygiene regimen look like? Are you really taking care of the health of the scalp? Critically important before we do any kind of intervention, especially if it would require something that we're doing to the scalp, whether it's low-level laser light therapy that you're doing at home or topical medication. We want to make sure that the scalp is healthy, that's likely to respond to treatment. Oral medications are obviously a part of it, nutritional supplementation. If you do have a scalp health issue, you're going to go down to the trichology department and get a complete evaluation and treatment regimen there. And then we're going to talk about the regenerative types of therapies and treatments to protect the existing hair. So leveraging platelet-rich plasma, stem cell-derived therapies like exosomes, using biologic scaffolds such as umbilical-derived treatments and things such as that. Perinatal biologics are cutting edge right now, or even synthetic scaffolds. I'll be presenting in Berlin this year at the International Society of Hair Restoration Surgery on the use of polydioxanone, which are tiny threads that can be placed in the scalp for hair growth. And so in those non-invasive treatment regimens, you're going to get some powerful effects. And that's going to be a great solution for the ongoing hair loss process. And then we can talk about transplantation, moving hair follicles around to replace lost density using the FUE approach with designing natural hairlines that are not going to be straight across like you see on TikTok. They're going to be looking normal and natural. And the angulation of the hair is critical in order to achieve coverage with the minimum amount of grafts, right? Instead of
Yeah.
having to worry about, oh my God, can we hit this maximum density in the transplant? Actually, my job is to create the maximum coverage with the least amount of investment of grafts for each patient. And we do that to preserve the donor zone because, obviously we don't have hair follicle cloning yet, but we can bank your hair follicles in preparation for that. Certainly that's an exciting new technology as well.
Well, I mean, in light of that, what emerging technology and treatments do you think will genuinely move the needle for patients in the next few years, Doc? Because if anybody's going to be at the forefront of it, it's going to be you. So, any insights you can give the people that are watching this, just to say, what emerging technologies do you think there actually are in the next few?
Sure. So what I've seen, I mean, in my practice, I would say over the past 5 years, the biggest changes have been in the world of regenerative medicine, stem cell derived therapies. So exosome therapies getting stronger, better. We actually are soaking grafts in exosomes during the procedure, and we're noticing a faster acceleration of regrowth from the transplants. So for 30 years, we've had to wait 6 months to see half of the result in our patients. And having gone through a hair transplants multiple times, it takes time. Can you imagine now today, patient after patient, we're seeing half of the results being visible at just 4 months. So
Wow.
we're getting a rapid acceleration. Stay tuned. I've submitted that for presentation as well. And we've talked about it at some of the more
Exciting.
advanced stem cell type conferences. We also are using growth factors and peptides in the office, pushing them through the skin using sonophoresis, which is an ultrasound delivery device. And so that's a treatment called ALMA-TED, transepidermal delivery. Of course, that requires a visit in the office, but you can use growth factors and peptides at home. Those are non-pharmaceutical agents. But I think the exciting part is, as we said before, we don't have hair follicle cloning yet, but I'm convinced that with the advent of AI, and even today there was some news how AI predicted that certain cancer treatment was going to work better, and then now it's actually borne out in the clinical trials. So we're going to see more and more of these breakthroughs as we leverage artificial intelligence to help us along. So hair follicle cloning, not available yet. They're using skin organoids. In fact, I just talked to Carl Kohler up in Harvard just a couple of days ago. I'll be visiting his lab shortly. He's able to create skin organoids. Those are spherical, skin-shaped spheres inside his lab that have hair follicles within them. Are they ready for transplants? Not quite, but it's the first step in actually being able to create an organoid or a hair follicle that we can potentially manipulate and then move into the scalp, hopefully as an unlimited supply. One of the coolest technologies that I've come across today is a treatment that is derived from a company called Acorn. Very, very famous biotech company that started out in Canada, now in the US. They can bank your hair follicle stem cells, and that would be hopeful for in the future. Obviously, you want the youngest possible cells. Like, I don't want to clone my 70-year-old hair follicles. I want my 53-year-old hair follicles in the bank. And so that's why almost 3 years ago, I banked my hair follicles. But they're able to culture some of those cells and produce what they call a secretome, which is all the secretions from those cells that contain the growth factors and the cytokines and the exosomes, and collect that material that's from your own cells and then essentially purify it, concentrate it, freeze dry it, and then send it back to our clinic. We can keep it on ice. And when you come in for a treatment, we can then deploy that onto the scalp. It's not an injectable treatment yet, but we've seen some interesting results with that. In 2026, they're going to be working with a clinical trial that's going to enable us to do the injections of that particular product. So I think these are just some ideas. that we're seeing, in addition to other technologies like small interfering RNA, potentially to disrupt the androgen receptors in the scalp, and more refined uses of exosomes and nanotechnology to really protect the existing hair. And that's, always very, very exciting. So stay tuned. I think there's a lot of exciting developments coming of age now in the world of biotech, especially for hair loss and hair restoration. And I guess we can't have a discussion without PP405. As you know, UCLA is working on a breakthrough molecule that might help us out. Studies remain to be done, and we'll all see how good or great that is. And if it's better or equal to existing treatments, I'm all for it as long as it's safe. And that's what needs to be elucidated through clinical trial work.
That's
But the
amazing. So,
future's bright. That's what I would say.
I mean, you just blown my little socks off there. But in brief, what would the cost element be for that to the general public to go and freeze their hair and keep it on ice at Bauman Medical?
Yeah, actually, it's not an expensive bit of business, to be honest. I mean, we do have to do the plucking, so you could do it without any kind of surgical intervention whatsoever. We do have to pluck several dozen hair follicles and make sure that they contain enough biologic material. Visually, we can look at them under the microscope, and we put them in a storage solution. And there's a very, very specific type of kit that needs to be packaged and sent overnight to the company, to Acorn.
Is that what the
So
cost element is then, I suppose?
yeah, the cost of is really that packaging and the harvesting. So that's about under the cost, under $2,000 to do the harvesting, 2,000 US, and then you work it out with the tissue bank, however long you want to work out your subscription. But I will tell you, it's less than the cost of Netflix per year, typically, to bank your hair follicles. So I think that there's a lot of great benefit there, and especially peace of mind for those who are dealing with the hair loss situation, or potentially those who have had multiple procedures and know that they have limited donor hair available, instead of having to tap into the beard or the body hair for alternative sources of donor. Hopefully, we're praying that eventually we'll have hair follicle multiplication down in the future.
Well, next time I'm in Boca Raton, I'll be down at Bauman Medical to go through that process because I'd certainly like to do it. But look, Doc, tell me this. We'll finish up with, your opinion on kind of the trust and transparency in the industry. The industry can be a very noisy space, as you well know, after being in it for nearly 30 years, with many mixed messages everywhere online. You referred to TikTok just there, but what advice would you give to patients trying to navigate this space and how they can truly identify a kind of ethical, trustworthy practitioner like yourself? What are the signs that they need to be looking for?
Yeah. So are you saying that we shouldn't be boiling rosemary leaves in a pot on our stove and applying that product to our scalp?
Well,
Is that what you're
hey,
saying?
I don't know if it gets
Literally,
confused, buddy. Maybe we should. I don't know.
literally somebody sent that to me today. And look, I'm all for an organic and holistic approach, but I think the problem with those types of miracle TikTok cures that every influencer who has not even a medical degree, but not even any kind of a degree whatsoever, maybe an eighth grade education, unfortunately, is that they're missing the boat and they're causing a delay in the hair loss process. So obviously be cautious out there, and something that sounds like some easy miracle rice water cure is probably not going to work. I would suggest that you stick with board certified hair restoration physicians. And notice I didn't say dermatologists. And there's no offense to my great friends and colleagues who are in the dermatology field. Many of them are well meaning in terms of taking care of hair loss, and they know what they've been taught decades ago in their training. But the vast majority of dermatologists never even have access to a hair restoration practice during their training. They never understand how to do the measurements. They don't know how many platelets per microliter need to be created in a PRP for hair follicle stimulation. So unfortunately, your local expert is probably not your dermatologist. So I'm sorry to say that. So I would say you need to find board certified hair restoration physicians. Find out from the American Hair Loss Association. Go and seek out those who are members of the International Alliance of Hair Restoration Surgery. And I know that you have a robust list of physicians that you have vetted, and I'm thankful to be a part of that. And I hope that we continue to be worthy of that, because those are the bright lights in the dark noise of what's going on today in social media and in the back alleys that are now being promoted as miracle cures and things like that. People need to follow the science and not get caught up in the hype. As we mentioned, there are molecules that are being developed. There's organoids that are growing in labs today, but that's not ready for prime time. We need to take measurements. We need to evaluate our patients holistically. And that's not going to get done over an internet chat. It's not going to happen on WhatsApp. It's not going to happen on iMessage or whatever. You need to be face to face with your physician, with your caregivers in order to get the right evaluation and protocol. And then you need to follow up with them because the follow up measurements tell you what's going on. So I always say, do your homework, please, to anyone out there.
Well, look, indeed, Doc, you've been a part of Spexhair. You've been a part of all the resources that I'm heavily involved in that get a great deal of exposure for good reason. You definitely are, without a question, one of the best, most ethical, leading hair transplant, hair restoration surgeons in the world. I'm proud to be associated with you and work with you. And, I really appreciate your time and interviewing you today. What I'd really like to, just finish with, Doc, is, if you could just tell people that are watching where they can find you. Their information will be ready available with this, but if you can just give them and surmise how to get in touch with you and your team at Bauman Medical.
Sure. So even though my main practice, Bauman Medical Hair Transplant and Hair Loss Treatment Center, is located in Boca Raton, Florida, we do have a satellite office in New York as well. And oftentimes we pop up in a variety of different locations, whether, believe it or not, Indiana and Chicago and LA, and all places in between, because it's so needed that we are either health and wellness expos, we're meeting people on the ground. But I would recommend for anyone, and since we do have an international practice, many people do reach out to us through the website, baumanmedical.com, where they'll find literally thousands and thousands of pages that I've written over nearly 30 years of being in the field, hundreds and hundreds of hours of video that they can consume and education about different treatments, procedures, what they can appropriate expectations. They can watch people go through every single treatment process, whether it be prominent physicians who've had the procedure with me or prominent health experts like Dave Asprey and other folks like that. They can see their first person accounts of their process. If they have a question, they can go to baumanmedical.com/ask and just type in a question, any kind of hair loss question, almost any kind of question I can answer, but I would prefer that hair loss questions. And be sure you put your name or name and phone number in there, or at least an email address so I can get the information back to you. But of course, that is baumanmedical.com is the place where people start their journey of hair restoration, and they can elect to have a consultation, which can be started off with a video call, or it could be done in the office, like I said, here in Boca Raton, Florida, or at my satellite office in New York, or at any other of those locations where we're popping up here and there at health expos, wellness expos, longevity expos, and the like.
Can you tell us a little bit more about Dave Asprey? Fascinating guy. I followed him on Instagram for a number of years. I'm transfixed by the majority of stuff that he has to say. I find him incredibly engaging guy. You are the surgeon that performed surgery on him. You're good friends with him. You've known him many years. Can you give us some insight into kind of how his surgeries have gone? And what else is Dave, that you're allowed to tell us, doing with his hair? Because it's looking very good of late.
Sure, sure. So I've known Dave for many, many years through the American Academy of Anti-Aging. He was a keynote speaker, as was I. That year, many years ago, he invented really buttered coffee, and invented and coined the word biohacking. He was dealing with his own health problems and figured out ways from kind of I would say almost a computer science approach, a systems management approach on how to fix his own body. And that led to an entire movement, which is followed by thousands and thousands of people who go to his conferences and listen to his thousands of podcasts about all manner of health and wellness and vitality and longevity. The guy plans to live to 180. So he wanted a thicker, fuller, healthier head of hair. He made some mistakes with his biohacking, I would say, using hormone pellets like testosterone, which really receded his hairline about an inch or so quite rapidly and resulted in a large bald spot. And he won't mind me telling you about that. But we talked about his hair loss situation, and I presented to him an idea in terms of transplantation. We moved about 10,000 follicles in a procedure, which was about 4,000 grafts to the crown and the hairline. And we put him on a regimen of treatment, which also included the Bauman Turbo Laser Cap, as well as some other items. And so over the course of time, he's regrown his hairline. He just had a single procedure. I can tell you that he loves it. You
Well, he
can
looks
watch
great.
his videos. He really has a substantial regrowth in those areas and complete coverage in the crown from the treatments that we did. And he is very diligent. I mean, not only does he take about $3,000 worth of supplements every month, but he uses the Bauman Turbo Laser Cap. He admitted to me almost every day for 5 minutes. And, that's been a huge part of his regimen. Dave is an amazing leader in the world of health and wellness. And, I don't know if you plan to live to 180, but any kind of longevity that we talk about talks about health span, right? Not just the number of years in your life, but the amount of life in your years. And I like to talk about hair span, right? The number of years that you get to enjoy a thick, full, healthy head of hair. So, Dave Asprey is one of those prominent people out there in the world of health and wellness who could literally go to anybody that he wants to in the world for hair restoration. And I'm honored that he chose Bauman Medical.
That's fantastic, Doc. Well, listen, Dr. Alan Bauman, thank you so much for your time today, for giving us an insight into everything that you're a part of, everything that's coming up in the hair restoration world, and just your insight into this practice. We will guarantee speak soon, if not see each other before then. And thank you for all your help in educating and helping every patient that comes your way, because you do an excellent job. And like I said, proud to be associated with you, and just keep up the great work.
Thank you, Spencer. Great to be with you. And don't be a stranger. Come on over to the States and spend a little time in Boca.